we're going to talk about coding. It's important for medical billing teams, as well as the physicians who are coding for these visits, really understand both CPTs and ICD-10 codes. Now, out of these two codes, you could ask a team of medical billers and coders which one is more challenging for them to understand, and most will say that it's ICD-10s by far, which are going to be more complicated, right? There's more of them that you could be using in a day-to-day outpatient practice. And so we're going to talk about the top 3 things your practice should know when it comes to ICD-10 codes. Number 1. ICD-10 code specificity. This is probably one of the number one things that I have seen personally as, we've been auditing clients and looking at their own billing and coding. So did you know that it does matter how specific your ICD-10 codes are? So specificity matters. And I know I've said that before, so we're going to talk a little bit about that in detail. And if you've ever gone to pick an ICD-10 code, whether it's in your EMR or in a book or online through Dr. Google, and you just select kind of the first one that seems appropriate for the diagnosis, but it has the word unspecified in it, it may matter. And so it may be the first one you see in the drop-down list in the EMR, but it may not always be the appropriate one to pick. Picking the right ICD-10 code actually does matter, and it actually can result in either decreased reimbursement or even a denied claim. Now, of course, there are going to be times that you need to have an unspecified diagnosis and where it's going to be acceptable to use. And even CMS recognizes that unspecified codes are going to be necessary. And they specifically say when sufficient clinical information is not known or available about a particular health condition to assign a more specific code, it is acceptable to report the appropriate unspecified code. So hear me when I say it's not that you can't ever use that, but say you use unspecified, but there's laterality left or right that is appropriate, you need to add that.